My name is Nancy Morris, and I am the director of the PhD program. So I've just been in that role a little over a year, and prior to that I had been faculty. Our PhD program is for nurses who are interested in pursuing a degree in which they'll gain some research skills in order to really advance the knowledge of the discipline of nursing. So students are attracted to this kind of a program when they want to extend their scholarship in particular, as opposed to just their clinical practice arena. So nurses who are interested in engaging in research and in the academic world, for the most part, are drawn to this type of a program. A lot of PhD programs in nursing work on an apprenticeship model, and so students find a faculty member who does research in an area that they're interested in, and they mentor closely with them. We are a little different in that we follow Bernard Lonergan's educational philosophy, and we allow students, encourage students actually, to follow their own horizons. So wherever their interests lie, we mentor and coach them along the way, helping them to find the experts they need to build out their research team. But we have that flexibility built in, which is not common in a lot of PhD programs. We have a real nice eclectic group of students. So we have students who have been nurses for 25 years, and we have students who have been a nurse for 1 year, and we have students who come directly from their undergraduate program into the PhD program. So they bring a breadth of diversity and experience, which just enhances the classroom environment and discussions that entail. A nurse with a PhD has lots of opportunities. So many do choose a more traditional academic route and work as a professor in higher education. Others do go into industry and work with research in that interaction with patient experiences. Others have gone into policy and are active in the policy arena. And we have graduates who have also engaged in state organizations and professional associations. We use a cohort model, so we take a group of students in and we ask them to stick together for their coursework for the first couple of years, which really helps provide a lot of support, and students seem to really benefit from having strong relationships with their colleagues. So that works quite well. And we also have a practicum experience that students have an opportunity to choose either research, education, leadership, wherever they think their greatest learning need is, which gives them an edge up in that arena. So those are two special aspects of the program that students seem to really appreciate. We have a great group of faculty here within the School of Nursing, nursing faculty as well as a biostatistician readily available to the students, and really very close mentoring relationships. So the students and faculty work well together. Most students take about 4.5 years if they come in post-masters. Obviously the bachelor students take a little bit longer, and those who might have a DNP already will be a little bit shorter. So on average, time to graduation is 4.5 years. It takes 2 years to get through the coursework, and then really whatever the dissertation focus is, that is quite independent. Students can finish within 1 year, but many take 2 to 2.5 to finish up.